Auzubillahiminash-shaytanir-rajeem. Bismillahir-rahmanir-rahim. Dear viewers, dear students और dear admission seekers, आज हम बैटरी प्रॉब्लम्स एंड सॉल्यूशन चैनल से आपको खुश आमदीद कहते हैं। बैटरी प्रॉब्लम्स एंड सॉल्यूशन चैनल से मैं हूं आपका होस्ट प्रोफेसर डॉक्टर मजहर अयाज, चुलिस्तान यूनिवर्सिटी ऑफ वेटरी एनिमल साइंसेज बहावलपुर से। Dear students, dear practitioners, today we will be discussing about the disease of parasites, especially parasites of the parrots and exotic birds. And this is the third part where we are dealing with the ectoparasites of these animals. I am your host, Professor Dr. Mazhar Ayaz from Veterinary Problems and Solution Channel, Cholistan University of Veterinary Animal Sciences, Bahawalpur. Here you can discuss about veterinary problems in exotic and domestic birds and pets. As you know, the parasites, they are infected with the ectoparasites, and this is the third part of the parasites in the parrots. There are most of the lovely birds, and it is prevalent. They are prevalent worldwide. You can see these ectoparasites can be so dangerous for the parrots, and sometimes they may lose their feathers and with the naked body, as this can be observed in these slides. One of the major disease is the scaly face or scaly leg mites. These are the pneumococcal mains. They can affect the beak and face of the parakeet. And these pneumococcal pili, also pneumococcal pili is common in badgeries and rare in other cetacean species. In badgeries, white porous proliferative incrustations are involving the corners of the mouth, series, beak, and occasionally the peri-orbital area, legs or vent are typical places. In passeries, birds, particularly canaries and European goldfinches, crust form on the legs and surface of the digits. Their tassel foot. The mites can be recovered from facial scraping of the badgeries. Although the clinical appearance is generally pathognomonic, in passeries they are affected with pneumococcal. Skin scrapings of the legs are often results in hemorrhages are generally not recommended. Regarding the treatment, ivermectin 0.2 mg per kg body weight per oral or intramuscular is mostly recommended, while moxidectin is generally effective. The treatment can be repeated in 2 weeks. This is the picture of the scaly leg. Here you can see the crust on the legs of the parrots. Pneumococcal pili, the scaly face or the leg mites, the badgeries, New Zealand parakeets, grass parrots, Polypterus parus. Crusty lesions can be found on the beak, face, legs, margins of the vent and wingtips, and same the treatment can be used after 14 days. Frequent use of these medications can cause ataxia and depression in badgeries, finches, kingfishers and woodpeckers. The very small dose, that is 0.0 ml, may be toxic. In some birds, 1 drop of drug is directly applied on the lesions also. And moxidectin can also be used topically. The feather mites. Cetacean birds are seldom affected by feather mites. Occasionally infestation with the red mites, Dermanisis gallini, may be found in outdoor aviaries, especially in nest boxes. A causative relationship between the mites and the feather picking is often associated or assumed by the owners of the feathers picking birds, although this is rarely the case. More common behavioral husbandry and other systemic factors are linked to feather loss. This may be treated with erythrine spray, 5% carbaryl powder or ivermectin 0.2 mg per kg per oral or intramuscular repeated in 2 weeks. The nest box treatment includes mixing 5% carbaryl powder into the nest box substrates. Cages should be cleaned thoroughly and wooden nests should be discarded and replaced if the mites are observed. Ear sac mites, air saculitis. This is caused by the sternostoma tracheocolum that parasitize the entire respiratory tract, mostly frequently of canaries and golden finches. The mites are often found in the trachea, syrinx, lungs, and air sacs. All stages of mites are found within the respiratory tissues. The life cycle is poorly understood. In mild infections, birds are usually asymptomatic. In heavy infections, audible dyspnea, high-pitched noises, and clicking can be observed. Sneezing, tail bobbling, and often mouth breathing are noted. Copious amounts of the saliva are seen in the oropharynx and xylem that can be present. Signs are exacerbated by handling and exercise and other stresses. Mortality can be high. Trans-elimination of the trachea in a dark room kindly reveals the mites. The treatment should be administered quickly with the minimal handling like ivermectin on prescribed doses and moxidectin in prescribed doses after they may be repeated in 2 weeks. Cetodized nudus, sternostoma, tracheocolum, the air sacs, that canaries, golden finches and parrots and badgeries and the cockatiels, they may be showing lethargy, changes of voice, production of sucking or clicking noise due to the irritation caused by the mites. Visualization of the mites in the trachea with powerful light source or detection of the eggs in the fissure of trachea wash can be diagnosed. Ivermectin with antibiotic can be given on a prescribed dose because overdose can lead to the toxicity, and that can be applied on the skin between the scapula also. Sarcoidosis. Sarcoidosis is a major cause of mortality in parrots housed outdoors. A high mortality rate is observed in untreated birds such as cockatoos, African grey parrots, and lectus parrots. Cockatiels are also susceptible, and renal as well as pneumonic lesions can often be noted upon necropsy. Clinical signs can be lethargy, passive regurgitation of water, respiratory distress, weakness, ataxia, and anemia. In Old World parrots like cockatoos, African grey parrot, disease occurs in the early stages of infection as the parasite is undergoing schizogony or mirogony, that is asexual reproduction in the lungs. This causes lung damage and the bird die acutely with or without sign of the respiratory disease. In the New World parrots like macaws, chunrays, the organism insists in the muscles or CNS causing weakness, ataxia, and neurological sign. The disease can manifest as a asymptomatic or clinically apparent muscular disease, cardiac disease, acute pulmonary disease, or encephalitis. Encephalitis, paralysis, intention, tremors, and head tilt has been observed in cetaceans and raptors. Regarding the treatment, protected treatment with trimethoprim, sulfa, and methamines have been with limited success. Pneumococci, dermanices, and stenostoma mites. The host pigeons, raptors, parrots, and finches and canaries. Symptoms: scaly beak and tassel foot, bald spots, anemia, weakness, respiratory distress can be observed. Treatment is that can be used. Avian insect liquidator can be used against the insects. Then Meniscus gallinae, red or roast mite. They are observed in the canaries. These mites feed on the birds during the night and leave them at morning. Skin irritation, anemia in young birds is observed. Ivermectin, moxidectin, they can be used, and mostly the life cycle is on or around the birds. The bird louse, they include the subbirds Ambulocera and Echinocera. The host are all the birds are common hosts. Symptoms: constant preening, scratching, feather ruffling, slight feather damage, discoloring, and restless can be observed. Regarding the treatment, mild pet insecticides can be used. Spraying gently ruffle the feathers. The other blowflies hosts are found in all birds and found in they suck the blood of the nestlings and can injure or kill them, cause diarrhea or wounds. Treatment is diatomaceous earth is a safe and effective killer for these flies. Lice, Neositoconormus and Sitoconormus, Immunopian, Pacifiminopian, Seconiphalus, Menacanthus, or chewing lice. They can be observed on the badgeries, cocktails, lovebirds, raptors, falcons, cattle ergot, snowy ergot, rusty marginated iguanas, and Indian peafowls. Severe bite-induced pruritus, anorexia, weight loss are observed. Self-mutilations activities of the bird increase the risk of secondary bacterial infections. The perithrin sprays can be of recommended dose can be of some help. Hippobocidi fly, they are louse flies or parrot flies. They can be found in raptors, pigeons, wild parrots, red-crowned parakeets, ostriches, swift swallows. They mostly suck the blood, and their treatment can be the dusting powder with perithrins and sprays. Echidnophaga gallinaceae are stick-fast fleas. They are very much important cetacean and raptor, pigeons, parasites. The stick-tight flea or stick-fast flea attaches firmly around the head and ear of the birds. In severe cases, hyperkeratinization, irritation, blindness, and anemia may occur. The perithrin spray can be of some importance, and sometimes the change of the nest is also important. This is all about the ectoparasites of the parrots and other birds, and I hope this will give you a lot of benefit. Thank you. मज़ीद अपडेट्स और क्वेरीज के लिए हमारे इस चैनल को लाइक करें, सब्सक्राइब करें और व्हाट्सएप नंबर पे आप हमें इसमें मज़ीद अपने कमेंट से आगाह कर सकते हैं। थैंक यू।